Hello, my name is Ness Churn. I am a counsellor and I'm also someone who has lived with the pain and challenge of endometriosis. So endo, as we call it, is a chronic illness, and that means that rather than an acute thing that happens and then it's over, endo is ongoing. It can last a very long time. It's a physical condition, meaning that there is pain in the body, and this is caused by tissue that resembles the lining of the womb being in the wrong parts of the body. So basically that tissue exists normally in the pelvic area but not always, and bleeds with a woman's monthly cycle, but because it's in the wrong place it has no way to escape, and therefore it causes pain and congestion, sometimes things called chocolate cysts, and adhesions where parts of the body stick together that really shouldn't. So endo has symptoms that include heavy, painful periods, but not always, pain with sex sometimes, and other parts of the body can be really horribly affected, like the bowel and the bladder, which causes further pain and embarrassment. So although it's a physical illness, obviously, there are mental health issues coming from this. You know, people often have anxiety because there's so much uncertainty. If I go out, will I be okay? If I go to work, will I be okay? Will something embarrassing happen? Will there be really huge blood clots? Will something happen with my bowels? So it's likely to cause anxiety and depression because life changes. And sometimes too, people can withdraw and become very insular when they're suffering. So why therapy? This is a physical illness. Why? How could therapy help? Well, it can be shocking, actually, discovering that you have endo. Sometimes it's a relief because you might have waited a long time for diagnosis and finally finding out what it is feels good. Other times it can just be horrible to find out there's this thing that exists which you feel you have no control over, that's debilitating, that stops you living life as you'd like to. It can be confusing because you don't know really what the next day, the next year is going to bring. You don't know whether you can book a holiday or not. You don't know whether you can arrange to see friends. And you don't really get what your choices are and how to make them. So confusing and isolating too. I think it's hard for others to understand really what it's like to have endometriosis. You know, your female friends, they might just have normal regular periods and a bit of pain maybe on day 2, and hard as they might try, it's really difficult to get a sense of what it's like, even though they might hear you sobbing down the phone or see you writhing in pain. So you might be anxious, you might be furious, you might be distressed, and there's no cure. There are treatment choices, and then of course there's the question of children, infertility, babies. You know, I know of people who've been told in their early 20s, right, you have endo, if you want a baby, it's now or never, when they're not in a relationship or even considering that they might want to have children. So it's a difficult condition to have. It brings lots of uncertainty and you can feel very much out of control. So why therapy? Well, when you have a counsellor, you have a safe place to speak with an unbiased person who becomes like an ally, really. We're here to help you see more clearly so that you can make choices about life, about relationships, about work, and about the treatment. So I guess I see 3 reasons to come to therapy. One is to offload, one is to really feel safe to let go of all that you are feeling. You can sob, you can rage, you can share just what it's like without worrying about upsetting someone or them not understanding. So it's a really safe place to just go, wow, this is me, this is what's happening in my life, and to recognise all the impact that it has, how it makes you feel. The second thing is to be kind to yourself. Therapy, a good counsellor helps you to work out what soothes you, what is right for you. We're all different, what would be the ways to really help yourself, even though it might feel like there's nothing, but there may be little things that you can do and big things too. What soothes you? So being kind to yourself is important, and we help you look at that. And then thirdly, it's about making choices, the decisions that have to be made with hospitals, with treatments, maybe looking at your life and your relationship. Is it right for you? Looking at work, is that right for you? Can that be done in a different way? We help you to see more clearly in order to make informed choices that are right for you. Not right for me, not right for your friend, but right for you. And I think going on from that, you also get to hear your own voice and be more assertive. Sometimes when you're met with challenge at hospital, doctors, you really want to be heard. It takes something to really speak up and say, no, this is what I need. This is how it is for me. And us therapists, we can help you do that. So as counsellors, we do our best to really understand what it's like for you. And you don't have to work with someone who's had endometriosis. Us counsellors, we're used to working with all sorts of things. We're compassionate listeners and we're enablers. So we're here to help you through this. And maybe it's not you, maybe you're supporting someone with endo, and we can help you with that as well. What we're about is helping you to find your way through life more bearable so that you're not alone, and with the pain and the despair sometimes, and the uncertainty, the being out of control. We're here as a person who's on your side, helping you to find the best way that you can that's right for you. So if you have endometriosis, I wish you well. And if you're supporting someone with endometriosis, I wish you well too. Take care.